Let me give you two concrete examples of whole health, Rob. One of them pertains to diabetes. We know, particularly in urban settings, there's higher rates of diabetes, but there's also often a lack of fresh food. Sometimes we call these food deserts. And unfortunately, a consequence of this is that not only is there a higher rate of diabetes, but there's also an increased rate of chronic kidney disease and some of the complications of diabetes. And so one of the areas that's being researched right now involves the concept of medically tailored meals. So bringing in that aspect of what's not available in the individual's sort of holistic environment, which is fresh food, making that available to patients with diabetes, and using that effectively to get better control of blood sugar levels, keeping patients out of the hospital, reducing their morbidity with respect to chronic kidney disease. So it's really exciting. And that's not to say that medical treatments such as oral hypoglycemics or insulin are not going to be useful or important. They are. They're important tools in the toolbox. But if we can think holistically about what else is happening in that individual's contextual circumstance and intervene through multiple approaches, then we can achieve better patient outcomes. A second example, which I find really interesting, actually happened about an hour north of where we're sitting right here today at the port of New York, New Jersey in Elizabeth. It's a very urban neighborhood. It's residential. There are 25,000 trucks that were going through those neighborhoods every day to get to the port. And many of those trucks are diesel fueled. They are releasing air particulates that are harmful to health. And what this research that's been ongoing is about is actually measuring how many trucks are going through these neighborhoods, what's the air particulate levels, and importantly, what is the relationship between those and asthma? And interestingly, through the partnership between science and the citizens of that neighborhood, they were able to gather the data to successfully change the truck routes to avoid those neighborhoods by working with local politicians. Again, we talk a lot about asthma, and medical treatments for asthma are critically important, but when we start to think about what's causing the asthma in that built environment, then I think we could have a much greater impact on patients and their health.
I love that example because it takes us into the root cause of what often shows up in the doctor's office as a patient who's sick. But rather than simply treat that patient, if we swim upstream and really try to understand what is the root cause of what made this patient sick, we achieve a much, much better outcome. And that's really at the heart of what we call whole health.
Yes.
Thanks, Laura.